and with our own group as secretary. Lupa. Oh, dah baru record kan? Sorry. Sorry. Lupa. Got it. Okay, dah record ni. Okay, Assalamualaikum and very good morning to our beloved lecturer, Mr. Hidayah. So, we'll be debate for our own group actually with about the should healthcare service be free and universal. So, another group. So, Akmal, Wafi and Hazim will be proposition. So me, Fakrul, Karunisa, and Shami will be opposition. So Shamin will start first.
Hi, Assalamualaikum. My name is Nurul Sharmin. So for my part is proposition on healthcare. So for me, why we disagree because it's not possible to have a highly efficient, high quality health system that is free at the point of use. Publicly funded system cannot generate the funding required to offer the best healthcare solution available. Malaysia with healthcare systems that are free to the public and up rationing medical services. The most expensive treatments are often unavailable to the public if the government determines that the cost of the treatment do not outweigh the potential benefit. The only way to maintain a health system of the highest quality is to have the patient pay at least some of their healthcare costs, because nowadays if a government, if we free our cost from a government, maybe we're not getting a best service because we are not paid. But if we are paying the cost, maybe we can get the best service. So that's all for me. I pass to the next presenter.
Um, my name is Nokaronisa. Okay, my opinion is why I'm not disagree about free healthcare. Free healthcare may make people less motivated to make healthy life decision. Healthcare should a last resort. A healthy diet, exercise, and personal development are key to health. If healthcare is freely available, people may start to worry less about preventive measures to protect their health. As a result, more obesity, malnourishment, and bad behavior may begin to crop up in society. Free healthcare is a path to a lazy society. In country where healthcare is free, people go to the doctor with trivial issue, miss appointment, and take abuse the free service. Because of that, I'm disagree about free healthcare can make people too lazy society. In country where healthcare is free, people go to the doctor with trivial issue, miss appointment, and take abuse the free service. This is a waste of resources and drain on the public coffers. Most people are under the assumption that it's remove the cost of expensive appointment and surgery. What free healthcare is supposed to do when implement is more the healthcare system to be fully support on government tax pay dollar, that any medical cost is little to nothing for at least 90% of people. Doctors and hospitals who have to supply care at the same cost, also eliminating the need for private insurance, changing the healthcare system from private only public destroy not only the incentive of medical. That's all. I pass to Fakrul.
So I pass to the Akmal or can start.
Who's next?
Okay, for me, why I agree with the healthcare should be free, because the first point is the choice of physician, which most of the private plans that people have to go to restrict them from choosing a physician of their liking or the person they may feel comfortable with. This is another reason why we need free healthcare system, so that the patient can have a say between choosing the physician he is more satisfied with. That's all.
And also for me, my name is Ahmad Aimanufi, and why I agree healthcare should be free, because uh, paying for healthcare is the biggest financial problem uh, for 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 people in Malaysia. Uh, and in 2018, uh, they survey published this make a survey healthcare found that 22% found paying their deductible was very difficult or impossible, and 64% reported that they delay or did not seek medical care due to cost. The cost of the family health insurance premium increased 80% in the between 2003 and 2013. The cost of health insurance premium for people who do not get coverage through work increased 105% between 2013 and 2017. That's all for me. I pass to the next presenter.
Ayan. Okay, my name is Azim. Dengar tak?
Dengar.
Yes, we can hear you.
Okay, my part is a proposition, and my point of view is why healthcare should be free, because of the free healthcare has far too many benefits that outweigh the small portion of the population that might abuse this newfound medical freedom. The medical world, since the beginning, has been dealing with a fear of cost to maintaining a health life. Some people are so afraid of the cost that they would rather not seek a medical help. Instead of allow for everyone to be able to see doctors and receive care for all their medical needs. While there would be an increase in patient and doctor visit, a real increase in those with alignment. The only things that would change is people coming in when they actually need to help or advice. So free healthcare should help someone who have a money issue, or they have some sort of problem with their money. So that's all for me.
Okay. So I very disagree with that. So like if you receive a product or service, you should be the one to pay for it. So you would go to get a message or expect someone else to pay for it. So you need to pay for it because that's your healthcare. What should you expect someone else to pay for your healthcare costs? So I am very disagree for that. So under the public funder health system, everyone taxes go towards paying for everyone healthcare needs, the healthcare people in society, and up paying for the service as used by the unhealthy. So they need to pay by their own self. Government cannot pay for that. So I am very disagree for that. The person will exercise regularly, eat healthy, and does smoke pays for the healthy service of fat lazy smoker is crazy unfair. For me, they need to pay for it because when you using that, they need to pay for taxes, electric bills, the medicine, and else. So I pass to the opposition proposition. I'm very
Okay, I
disagree for
will
that.
reply that. For me, why the government of Malaysia give the free apa free the healthcare service because of uh, the government of Malaysia uh, understand why uh, Malaysia while the uh, uh, why Malaysian people not have to pay the healthcare service um, because of um, uh, because of if the family have a child of two or one, uh, government uh, government gaji not so high. The average of the salary 1,200 or 2,000. So that's not enough to pay healthcare service because uh, it's not enough to pay because healthcare service should be high high apa high high pay. Yeah, that's all for me.
Okay, so if you say that government, you can pay for that, right?
Yeah.
So basically, government already pay for us. If you go to the clinic or some hospital government,
Yeah.
you just think that you just pay RM1 or 100
Yes.
above. But basically, what I know, I already learned about the Constitution Malaysian studies before. Actually, we not pay for RM1. We pay for 300 and plus. Actually, government already pay extra for us. So we just think like, okay, we just go to government and pay RM1. And that's just
Yes.
for RM1 for them to buy to pay their taxes, bill, and everything. So it's not
Yeah.
possible to have a high efficient, high quality health system for free and a point of use. Public founder system or cannot generate founder and everything for their healthcare. So for me, that's not have any problem because that this come from yourself. So what say you? So I pass to the next presenter or the next presentation.
Okay, my another point of view is the government should make a program. Maybe some of you already know that when you donate a blood, you receive a card, donation card, blood donation card. With that card, every time you get your so every time you donate your blood, you will receive stamping on that card on that card, and you will collected the stamping. If I'm not mistaken, when you receive more than 10 stamp, so you will be receive a benefit on the government hospital. So my point of view, if you really need free medical healthcare, then the government um, should do more program like that. For example, it's blood donation, or maybe uh, anything for the citizen. So that's my point of view.
Okay. So you said that government not do something for them, give a medicine or whatever plan for the health, right? So,
Like tak dengar.
anyone here?
Huh?
Okay. So you said that government.
Nanti dengar terus.
No.
Hello, opposition.
Okay.
Opposition.
So, for me, healthcare should not be provided free, regardless of a person's income. The health of a person is in their own hands, and they should therefore be held accountable for that. Do you agree with this statement? Because free medical facility has always been a controversial issue. Some citizens personally believe that free medical services should not be provided on the basis of income, as each person is responsible for protecting their health. I do not agree with this viewpoint. Since nowadays people tend to live a sedentary lifestyle, there is an obvious probability that it will attract several health-related problems. The unhealthy eating habits and lack of physical activity causes innumerable health issues. It is extremely that people receive the free medical policies from the government or from their organization, so that they are compelled to visit doctors for routine checkups, such as it is imperative that employees who work for IT should be given free insurance for their medical treatment coverage to avoid the previous negative impact of computer jobs. Um, However, the health authorities must realize that healthcare is a basic requirement to transform the world into a disease-free place, and we shall not hold any restriction based on the financial issue of any citizen. There are numerous diseases that cannot be prevented, and some patients are suffering from chronic disorder that hereditary in nature. For my example, cancer is often passed down in the genes of a family. Moreover, some existing elements become worse due to environmental pollution, For me, I have asthma. Asthma is also one of such disease that affects people living in polluted surrounding, and there is no easy way to prevent it. So it is evident that the health of a person is not always determined by their lifestyle or choices. Free healthcare system should not be implemented for all the communities. So that's all for me.
Okay, for me, why I agree, because is no uniform benefit which with the distinction between private and government healthcare system, you will find a vast difference between how they operate and treat their patients. While people will spend millions on the private health sector, which they did not deserve it, which also by combining resources and working on the same platform to provide a free medical care, people will have equal benefit without thinking of poor or rich. That's all.
Nisa is like,
For me, um, to conclude, also people can take precaution in their life. There are many factors which are responsible for the health issue, and the health ministry should consider the difficulty involved in staying disease free, and thus free medical treatment should be provided to everyone in the society regardless of their financial issues. So how about that?
Sorry, come again.
Pardon?
Sekali lagi tak dengar. Sorry.
Oh, sorry lagi. Okay, wait. To conclude, also people can take precautions in their life. There are many factors which are responsible for the health issues, and the health ministry should consider the difficulty involved in staying disease free, and thus free medical treatment should be provided to everyone in the society regardless of their financial status. So for me, for those who having financial issues, maybe we can consider having medical for free, not for the not having financial issues. Aduh. Hello?
Hello,
Anyone?
ya.
position,
Coffee, ya. Coffee, ya, Pak.
coffee.
Um, to reply that, the that you said, for financial, for person have the financial problem, that's it's okay for get free treatment, right?
Coffee is that you done?
So uh, for me, uh, for me, I'll press to the next presenter.
Okay, so means you is on the way to disagree with that, right? So I just want to add, if you want to know, the government has done all sort of things Like they have done all sort of event, like do some event like boat leisure, whatever is it, like to help people, to help Malaysian people. Some of them
Yeah.
use only for the government money, help the people. So you should be grateful because you are still receive some healthcare from the government. Means of
Yeah.
some that is free, some of that is free. You no need to pay. So why you want the government give all the medicine or healthcare, whatever it is, be free? So it's not good for me. Like they need to pay something, and you can because all the costs are very high. Okay, if you wanna know the cost of medicine or whatever it is already is very high. So what say you? So I pass to the next presenter, Akmal.
Okay, to answer that, this government should subsidize the medicine. Okay, for the doctor, do you ever heard PPUM, Pusat Perubatan Universiti Malaya? They have the staff and the doctor there was a student in Universiti Malaya, so they do the study in there. So the doctor and the workers or patient are no need the government to subsidize. So the government should subsidize the medicine and the equipment only. So my point of view is the government should do more uh, hospital or apa ni hospital based on medical. For example, also for MSU, they also have a medical center, the hospital. So the healthcare should be free, and because not everyone afford to go to the hospital and receive a proper medical checkup or medical treatment. So this is the another opportunity for citizen or university to receive the patient to do their studies, and also the benefit also to the citizen. On the part of government, they also need to provide a subsidy, maybe some for medicine, also for the equipment lah. That's my point of view. So I pass to the
Okay, so for me,
your position.
I I also disagree because if we get free medical, the bad of having issue is we got higher tax because healthier people pay for those who need regular treatment. People with chronic disease like the ones suffering from diabetes and heart disease are a burden on the system. The sickest people consume half of the healthcare cost, and the healthiest 50% of the people consume only 3% of the cost. So, um, many people also do not want waiting for longer time for physician appointments and procedures. Emergency rooms start getting busy and overcrowded as typically. And the policies of the government also pretty much dictate money a doctor can make. But an excellent and doctor make nearly the same amount of money. Less competition means less innovation. Also, the dental and vision are generally not covered or not fully covered under universal healthcare. People still have to buy those. People also less careful about their health as there is no financial impact. Furthermore, healthcare costs overwhelm government budget. It also creates socialism and more government debt. However, medicine become a less attractive career choice. The cost of becoming a doctor is very high. Doctors often carry large student loans. It takes nearly a decade of hardcore education and training before they start practicing. Since their income is kept under universal healthcare, it will take longer for them to pay off their student loans and force young doctors to lead more frugal lives of a long time. So I pass to the opposition.
Okay, for me, I agree because health is not a privilege, which having access to a proper healthcare system, which not be deprived with, based on the financial status, case or intensity. Having access to a proper health and medical attention is a fundamental human right, which everyone should have access to it to improve human progress for the future. We should ensure we are providing people with the thing they need the most, including treatment of the disease that cause suffering. That's all.
Okay. I still on my I still disagree with that. Human are risk taker and free healthy might make them believe they can make more risks than my enjoy their life and livelihood. So is if the healthcare will be free, they will make more risks because they know that all the medicine or hospital be give their free service. So I am very disagree with that. Healthcare should be a last resort, a healthcare diet. So if you don't want to pay, you have to diet, exercise, and personal development are key to health. If healthcare is free, available, people may start to worse less about preventative measures to protect their health. As a result, more obesity uh, and bad behavior may begin to crop out of society. Free healthcare is a path to a lazy society. Counter agreement. Free healthcare has far too many benefits to outweigh the small portion of the population and they might abuse their newfound medical freedom. The medical world since the beginning has been dealing with a fear of cost to maintain a healthy life. So free healthcare would allow for everyone to be able to see doctor and receive care for all their medicine medical needs. While there would be increased patient and doctor visit, there would not be a real increase in those with ailment that free service. So they still need to pay for that. If not, you'll be make your own self freaks on something like accident or do more something bad things to yourself because you know all the fees will be free. So I still on my part is I'm very disagree with free healthcare. So I pass to the next presenter.
For me, providing the free healthcare uh, give benefit for the private businesses. Uh, if the Malaysia implemented a universal right to healthcare, private businesses would no longer have to pay for employee health insurance policies. That's all from me.
I want to
Um, for me, I still not disagree because healthy people who may hardly use the healthcare system are forced to pay. It's not a universal healthcare system. Medical for all can provide coverage for all. Due to non-payment of medical bills, doctor and hospital have to hire collection agencies, which is the result. in more paperwork for everyone. Plus, they have to pay commission that debt collectors charge. So, that's all for me.
Uh, I do agree with the point of Fakrul and Shamin. When medical care is free, so people will be take it easy with their health. So they taking lessly dia tak berapa jaga makan lah, means like that lah. So there will be obesity. I agree with that. But is if the medical who need, or someone who need it when there's unpredictable accident, something like that, or something like cancer, so they have no choice, and the penyakit is not predictable. So with that, sick of, they need to receive a free healthcare. So that's my point of view.
So Hazim already joined us on the disagree part of it should be free. So how about Akmal and Wafi? Is that you still on your position? Agree with free healthcare?
Yes, I'll agree. Free healthcare.
You still agree. So what's more point that you want to give us?
No point.
Because you said that you still agree with free healthcare. So we want to know what that makes
Free healthcare.
you still agree with that.
Right. Free. Give free healthcare. Help everyone.
What?
Free healthcare. Help everyone.
Free healthcare help everyone.
Yes.
But if the government don't have money, how can they pay for that? How can they pay for the doctors?
How can be government with no money? Then no government with no money. Right? Understand what I'm saying?
The medical people that have sick because of they know their free health care and don't need to pay. How can government have more money? Because people not pay for that. How can?
Like this time, COVID, COVID, right? So how can government pay, give all the citizen vaccine, free vaccine? So because
so you
of,
want to say that
yeah, because of government have money, so government free healthcare for everyone. Yeah.
okay. So if you said that government already give a free vaccination to the all the netizen all the people in Malaysia, so that make you agree that your part is good with that. So actually I'm still disagree with that. Actually,
So
I
you
think
should
this is
pay
very enough for that.
you should
Government
pay
already gives
vaccine lah.
so many things. Free vaccination to the billion people in Malaysia. How can they make some money for pay for that? We're not a very big country. We don't have a lot of money. So after the vaccination is free, then you want the another healthcare like hospital and clinic free also. How can them got the money? How can? Explain to me how can.
Explain. I'm tired of explain. I'll pass to Hazim or Akmal.
Azim already joined us because
I
Oh,
surrender.
yeah.
I surrender.
so Akmal and you only.
I
So
surrender. I
Akmal,
surrender. I surrender.
oh,
Yes, I do
okay,
it.
so you joined us. There's a disagree also.
Okay.
For me lah.
So Wafi still on
For me,
your position? Hmm.
I
Wafi
still
still want to
agree
fight with
with
us.
free healthcare.
Wait, Wafi, can you say back?
Okay.
Yeah, sorry.
I don't understand that. I can hear you clearly.
Oh, I still agree with free healthcare.
Okay. For me, why we can't have a free medical healthcare? Because if you have an accident and then you break your leg or your hand, you still have to pay because in the government, not your break hand, your break leg is not included in your medical service because you the one who accident, and then you also have to pay for what incident that you have um include, which is you have break your leg and your hand. So the government also ask you to pay either um you want to pay or not. If you don't want to pay, your leg or your break leg or your break hand may be something problem, which is like you're having you're having not normal hand or your leg, because nothing is free for now, like nowadays.
Yep, I agree with that.
So
Nothing is
Okay lah.
yeah. So what do you think?
Okay lah. Because of you said that, okay, I agree. I agree with you.
all right. So the opposition team is win for this debate, and
Yeah.
proposition already surrender with that. So that's all from me, from our team,
Thank
Oh,
you.
coffee.
Charmin and Nisa, Azim,
Yes.
Kamal, and Wafi about this debate for today, madam. So I hope you enjoyed to hear that. Thank you.
Thank you.
All right.
Bye bye.
Okay.